Hi, welcome everyone to a career conversation with Gary Passama, the retiring CEO of NorthBay Healthcare, NorthBay Health System. And Gary, you and I have known each other for 30-some years.
At least, yes. A long time ago.
So I can tell you it's a privilege to be here with you today. And on behalf of the California Association of Healthcare Leaders and the American College of Healthcare Executives, thank you for your service and all that you've done for the communities that you served.
No, thank you for that.
So next week's your last week?
A week from today.
And do you have plans?
The usual, take it easy for a little bit. I've got travel plans with my wife and myself for the rest of the year, and then I've got 5 grandchildren here in Solano County, so have some time to spend with them as well.
Are they younger, older?
9 and under.
9 and under.
So they're young.
So I was noticing, I don't know if you remember the CFO from Lucille Packard Children's Hospital, but he, on his Facebook, now has grandfather in residence under it.
I might have to copy that.
So as I was preparing for today, I went back and looked at your career history on the ACHE website, and you have what I think one would call a traditional progression. So you went to UC undergrad and master's in public health program, and then started as an administrative resident at Herrick Hospital, if I recall, which was then sort of built up into the Ultimate's California healthcare systems. So I was wondering if you would just help describe to us how that progression worked for you. What were the steps along the way that got you here?
Not sure anyone could do the same steps any longer, because when
I was going to ask you that at some point, right?
When I applied in graduate school from CAHL, I went straight from my undergraduate work at CAHL right into graduate school. There were only 16 or 17 accredited programs in what was called hospital administration at the time. And the expectation was, when you got out after 2 years with that graduate degree, you'd become part of senior management. And that was certainly my expectation. And I was very fortunate that at the end of my administrative residency, before I went back for my last 6 months of academic work at CAHL, Herrick Hospital offered me a position to come back to be part of their administrative staff. So I, at 23 years old, with hardly any experience, became a senior manager at Herrick Hospital and progressed there. I had some really good mentors, some people who taught me a lot and had confidence in me. And so in about, from 72 to 78, I went from being an administrative assistant to an assistant administrator to chief operating officer. In my last 3 years there, I was the chief operating officer at Herrick Hospital before I had this opportunity here at North Bay, which at the time was called Intercommunity Hospital. It was a 110-bed, basically primary care hospital, and not a whole lot of other things. But there was a great opportunity here in Solano County, and spent the last 35 years kind of working with a lot of good folks here, building up a healthcare system that's truly integrated. We own a health plan. We have a 120-member physician group. We have 2 hospitals. We have a lot of other kinds of services that are associated with the healthcare system.
And if I recall correctly, the 2 hospitals were originally separate facilities, that there was a merger?
No, there wasn't a merger. Actually, we built the hospital in Vacaville. The main hospital was here in Fairfield, called Intercommunity Hospital at the time. In 1987, when we opened up the new hospital in Vacaville, we thought a healthcare system, and so we called ourselves NorthBay Healthcare. NorthBay Intercommunity became NorthBay Medical Center, and the hospital in Vacaville became known as NorthBay Vaca Valley Hospital. So that was a 50-bed hospital built from scratch. Don't get that opportunity too often in your career to develop and build a new hospital.
Right, so I think so my recollection was, if I recall correctly, at one time they were under separate licenses, and then there was a consolidation of licensing. I remember helping Paul and you guys. Right,
yeah, we opened them up as, one of the mistakes I made was we opened them up as separately organized and separately licensed hospital. We did share one medical staff, but very quickly that became unwieldy and didn't make a lot of sense, and we were able to get a license over both of them so that it's singly licensed now.
So going back to your Berkeley experience and as you progressed along, did you have a coach, mentor who helped you along in that progression during those 6 or 8 years?
In Berkeley?
Yeah.
Yes, I did. I had a couple of them. Herschel Shelton, who's the CEO of Herrick Hospital, was certainly a role model for me in terms of the way in which he dealt with his management staff. He was very much a delegator, and I learned that from him. Lou Janza, both Herschel and now Lou are deceased, but Lou Janza was my first immediate boss at Herrick. He was both the chief operating officer and the chief financial officer. He had an MBA and an MHA. I learned a lot from Lou, particularly in terms of the financial aspects of healthcare, and he was a really good mentor. And then there was a third person there at Herrick, who I still see on a regular basis. His name's Bill Dalcello, and Bill was closer to me in age. He was 4 or 5 years older than me, and he became a role model, and because of the age being close, a person I could talk to very easily. So, and Bill and I still see each other. I would go to lunch every 2 or 3 months.
So that, if I do the math right, a 40-year career.
45 years.
45-year relationship.
10 years at Herrick and 35 years here at North Bay.
Was he your direct superior?
After Lou Janza left Herrick to go join the president's office at the University of California, yes, for the last, until he left to become CEO of Roseville Community Hospital. 3 years, Bill was not only my mentor, but he was my boss.
So, so this is an area of great discussion right now, especially with mid-careers who are trying to find their channel, find their way. And one of the questions that always comes up is, how do I take and have a relationship with a superior who then also can coach me, but I need to respect the fact that this individual also has supervisory powers, if you will, over me. Any perspectives on that from that relationship or from what you've been doing today with yours?
Well, I was always very respectful of the fact that particularly Bill was not only my mentor and in a way my friend, but I also had an obligation to him as the person who I reported to. And so I tried to keep the lines pretty clear in that regard. But Bill was the kind of person who liked to nurture people, who liked to develop managers, and so it was a comfortable thing to do, and I think you can do that. I've done it here. We actually have a very robust management succession program here at North Bay, and every year for the last 4 years, I have had at least one person in middle management who I was a mentor to. It was a formal program, and in some cases that mentorship relationship continued on after the formal 1 year engagement. And I think that's really valuable, and I think it's actually better if you don't have a reporting relationship to the person, because your mentee can ask you questions without feeling like, am I putting myself at risk in asking these questions? So that's the way it's worked here, and I think it's a good way. But the other way at Herrick certainly worked to my benefit. I learned so much from those 3 men.
So you say you have a formal program here. Is that a program that is restricted to current employees? Could someone come in from outside the organization and seek a mentorship with someone here?
Well, our program is designed as a management development program, progression. We have people slotted, and so we want to make sure that our middle managers have an opportunity to get the background and information they need to qualify themselves, if not for advancement here, because we are a relatively small organization. Prepare them, part of our responsibility is to prepare them for opportunities outside of our organization. Insofar as is it possible for people from the outside to have a mentor here, that's the answer is, the answer is yes. That's outside of this program, though, and in fact, I've done that in the past.
So you mentioned that your career progression is one that you don't think could occur today. What would you, from your perspective, see as the more typical progression today?
I certainly would have hired me 45 years ago and didn't know anything, had the academic requirements. I've seen a couple of different paths. There's certainly the more traditional one now is you're in a middle management position somewhere in the organization. You might be a nurse manager with a fairly wide range of responsibility over a specific program or service line, or you might be a director of pharmacy, which is a fairly big operation, and you go back and get the necessary academic preparation, and then you look for opportunities. to take on projects within the organization and to be in our succession program. And that's the way it's worked. So we have a leadership academy. Every year we have 12 to 16 managers who are in our leadership academy. They are expected jointly to do a major program, major project at presentation to senior management. And these projects have been really fascinating, what they've done. And so in doing that, you are brought to our attention as perhaps a person who has additional potential that needs to be developed.
So that's self-advocacy.
Yeah.
So I've got my position, and then I'm going to find a way to expand not only my skill set, but also make the organization aware of my capabilities,
Yes.
showcase myself.
Yeah, you may be a diamond we could find otherwise, but it never hurts to, show what you can do. And in fact, in my own career, dating back to Eric, anytime I had an opportunity to take on some additional responsibility, and yet maybe that I wasn't being considered necessarily for that, I would, talk to my boss and say, hey, can you give me a chance? Can I do this? So I think you really have to have enough confidence to say, I'd like to have an opportunity to show you what I can do.
So that's fantastic, by the way, too, because we, in some of our surveys and so forth, find that there's a hesitancy, that the personal downside of that might be viewed that I'm exposing a weakness, or I'm now in a competitive situation with others in the organization. I come from a viewpoint that level of competitiveness is good. It sort of rises the bars and the standards for everyone, but yet some are timid about it. But there's the concept of the project as well. So we often think of a project as I'm installing an information system, I'm building a new facility. I would imagine that your concept of a project and what you encourage is broader than that. Might include negotiating physician contracts and relationships, network development.
It's even broader than that
Okay,
in terms of what we do. For instance, we have one of our groups of managers who were in this leadership development program that 1 year segment. They developed the NorthBay Way, which is a series of precepts that now become part of our culture.
Interesting.
Okay? We call it the 4 C's. Another group developed a program called Creating Connections. And now, as part of our monthly management meetings, we put aside 15 or 20 minutes. This is a meeting where I bring together all of my 100+ managers. And we ask, anybody have a tale of creating connections? And it has to do with, how did you or your department touch the life of a patient or someone in the community on behalf of NorthBay Healthcare? So again, that was a project that came out of one of these groups. So they are fairly broad kinds of things, and they're meant to move the needle in terms of NorthBay's position here in our marketplace.
So in those cases, there, for example, in creating connections, I guess you could say there's some more specific start and end points to that. But in the sense of the NorthBay Way, that's a very broad mandate. That's a chance to change the fabric of the organization going forward. And were there a couple stars who came through?
There's always,
not
yeah.
names.
The answer is yes.
Yeah.
There's always, I can think of a couple of people in each of these cases who, these were groups of leaders, but always there's 1 or 2 leaders that kind of emerges from the group of leaders, and the answer is yes. In both cases there were, and in these other instances where we've got these, in our other leadership academy sessions, the same way that some people kind of rise above, and when that happens, we note it.
Is there a particular trait that you see when they rise above?
It's a confidence, the ability to articulate what it is that they're working on, and the ability to show how, you see how, when they talk about what was done, how it was done, and what their role was. It's in every case, it's been apparent there's been a leader or two. And what's interesting is these leaders are often selected by the other leaders in the group. They've been, the people in that group recognize these people as, I'm good, but this person may be just a little bit better and, better to speak for us now.
So confidence, so critical, sports, life, management. Have you had situations where you've had someone who has had an erosion in their confidence, something that might have happened in the work environment, maybe in the personal environment, and then you've stepped in to sort of help build that back up. And how do you do that?
Yeah, I can think of any number of instances. One fairly recently, we had a senior manager position open, and we tell our folks in our succession program that just because you're in a succession program doesn't mean you're automatically going to get a position if one opens up, but you will be considered. But we'll also look at outside candidates. In this case, we had a really well-qualified person internally, who I thought was probably would get the job. But we did throw a wide net, used a recruiter, and brought in some other candidates. And one of those candidates for that particular time in our organization's history was better suited to the job. And so the internal candidate was, my goodness, I've been developed, I've been doing these projects, and I've been getting encouraged by everybody, and I didn't get the job. So we had to go back, several of us had to go back and talk to her and say, time wasn't right. It doesn't mean you weren't a good candidate, but there were some other good candidates. I was talking to her fairly within the last week, actually, and she said, probably was right. Okay, I could have done the job, but not as well as it's being done now. But the experience has prepared me for the next time.
So that was a crucial conversation with that individual.
We talk about crucial conversations too.
I was going to sort of swing over to that, because these are good. These are the ones that sort of work where the organization and the individual continue on. How about the ones where it doesn't work, and you career counsel out or to a different position?
And that's happened as well. There was another individual, very bright guy, who simply didn't get a position as senior manager. He had 2 opportunities, and he decided, I'm going to go out and be an entrepreneur. I've got an idea, and probably I wasn't meant for this job at North Bay, because really when I think about it, my talents lie in a different direction. And he's off to a fairly successful start. He's actually recruited one of our other employees to join him. So so it's never a dead end. I think people need to understand that sometimes it takes a couple of attempts to find out where you really are best suited and where your career should go.
So back to your undergraduate days at Berkeley. What was the passion that got you into healthcare?
It actually goes back to high school.
There's always a story behind it.
Yeah, there is. I was very good in science in high school, actually in college too. And I was thinking, I want to be a doctor, okay? And the Alameda Contra Costa County Medical Association every year had, for people between their junior and senior year, a conference for people who are interested in medical careers. And although there was a focus on medicine as a career, they also brought in people from other sort of allied disciplines, nursing and all the other things, pharmacy. And they had booths at lunchtime where you could go and talk to representatives from that particular profession. So of course the medical booth was just crowded, all kinds of people talking to the doctors there, and the nursing booth was very crowded, people talking to the nurses who were there talking about the nursing profession. And there was this one booth over in the corner, and there was nobody there, okay? It was the hospital administration booth, okay? And I didn't know anything about hospital administration, but I wasn't going to fight my way through those other booths to try to talk to somebody. So I went over, and there was an administrator there, administrator of a hospital. And so I started to talk to him about what is a hospital administrator, which is the term we use then. Now we call ourselves something else.
Right.
And he started talking to me about how it combined an interest in medicine with an interest in business, and how you can do these great things. You're not going to be the hero, you're not going to be the guy who saves the lives, but you're the guy who provides the ability for all that to happen. And so as he started talking about it, he gave me some literature. Actually, I think it was probably ACHE literature, although it was ACHA then at the time.
Right, healthcare hospitals.
Yeah, he was actually representing ACHA. And so I started reading and even though I was years away from being able to do this, started writing to graduate programs to see what they were doing and what their curriculum was like. So by the time I got to Cal my freshman year, I was a pre-med student still, and taking all the pre-med courses, but I started thinking, maybe I ought to think about business too. So I took my freshman year, and actually I'm writing about this in my blog. I took a course in chemistry and economics at the same time. And I did fine in both classes, but I enjoyed economics so much more, and I began to realize I'm a big picture guy. You know, I'm not the kind of person who, a physician is basically one-on-one, okay? I realized I probably could get to medical school, and I could probably get through it, and I probably wouldn't be a very good physician because my interest lied elsewhere. And so I changed my mind my freshman year and started working all the prerequisites to get into business school my junior year at Cal. And by that time, I knew I wanted to be in hospital administration because it was going to tie my interest in medicine with my interest in business. And so I applied to 4 or 5 different graduate programs, the whole time wanting to get into the Berkeley program. I got accepted by all of them, but Berkeley was the last to accept me. So I was fending off these other programs who wanted me to, basically tell us you're going to come or not, waiting for Berkeley to make its final decision. Thank goodness Berkeley came through.
Yeah, right, it slid in under that. And look at how it then sparked that geographic proximity to sort of flow from there.
Yeah, it's kind of interesting because I got assigned to another hospital for administrative residency, and I had told the program, please, whatever you do, don't send me to this particular hospital. I had personal reasons why I didn't want to go there. So it's sort of like the Army. Guess which place I got assigned, okay, to that hospital. So I went back to the program director and told her, I really didn't want to go here, and you knew the reason why. Well, we thought it would be a good place for you, that you'd really work well with the CEO there. But if you really, really don't want to go there, we have one hospital in reserve. And we save always one hospital in reserve in case we have a situation like this. That hospital in reserve was Herrick Hospital. If I hadn't done that, I don't know where my career has gone. That one little decision put me at Herrick, and that's sometimes luck is more important than anything else.
That came with luck, right? The value of luck. Mm-hmm. So it's often said today that in order to rise to your level, you probably will have to relocate 4 to 6 times geographically. So you truly have been, by that standard,
I'm a failure.
You're a failure. Underachiever or overachiever, depending on which way you look at it. So you mentioned you have a blog. I didn't realize that. Mm-hmm. Is it a public blog or?
It's on a NorthBay's website. I've written over 600 entries. I started in 2000. Our public affairs department twisted my arm, and so I've been writing them usually 2 a week, sometimes just 1 a week. And my last one will be published next week, actually.
So we can go to northbay.org.
At least for a while, and they're there, and you can go back to the history ones. And I'm a little bit of an outlier in some of my opinions, which is good because it sparks discussion. And I've got I get about 800 to 1,000 readers every time one's posted.
Wow. From a HR perspective, does that ever cost you? For example, some would say we have to be careful what you post. Do you have your posting screened?
Nope.
So
no, I have our vice president of public affairs edits. He's a former newspaper publisher and editor, and he edits my raw material, smooths things out a little bit, but the ideas are mine.
So it's you.
It's me. Yeah, and I'm a little bit of an outlier. I don't always agree with some of the policy decisions that are being made by our own organizations, but when I was on the boards of those organizations, also, sometimes, I don't think we want people to always agree because you don't get good decisions when everybody agrees, which is, again, I think is important here at North Bay. I've got 12 senior managers, and none of them are yes men or yes women.
Knowing a few of them, I can definitely see that. So one of the elements of when you're in early mid-careers is trying to figure out a sort of a philosophical framework that you align your capabilities to and structure. And it could be a Covey framework. I'm a personal follower of John Maxwell. Could be Tony Robbins, who I really didn't get until I couldn't sleep on the road several months ago, and saw one of his sort of short clips at 1 in the morning. I'm kind of like, okay, now I get it, why people are attracted to sort of that high energy, especially in, for example, real estate and other entrepreneurship. So again, I'm a John Maxwell fan, some Covey in there. Do you have one that you have used or?
We use Covey for our management development program here. Okay, it forms the core of our program. We also use other aspects. as well, but COVI is the basic framework. I have to tell you, I'm a freelancer in the sense that I kind of developed my own way of doing things, my own philosophy, taking things from bits and pieces, and I couldn't characterize it to you in one term, but certainly COVI's had an influence, and as I say, it is core to our leadership development program.
And how about, how does that translate into your professional goal management, your time management? Do you have a particular framework or approach that you use for that? You know, some are, I write everything down in the morning, some are, I revisit every couple months.
Well, again, I'm a little bit eclectic. I do have lists, okay? I find that that's the only way I can keep myself organized. And I'm not as loosey-goosey as some people are, but you know, it's worked for me. I get things done. You know, again, I'm a big delegator because that's the way I was taught, and I expect people to take responsibility and report to me when they've finished what they're supposed to be doing.
Oh, super. So, looking back, top 3 accomplishments?
Oh goodness. You know, the thing that really stands out is one of the first things I did here was the Vacaville Hospital. That was a community that really wanted a hospital, and at the time we were in comprehensive health planning. If you remember those days, a lot of folks don't remember those days, but it was hard to get anything done within an existing hospital in California and get it approved by the state, much less get a new freestanding hospital approved in a different community. But we did it, okay, and we did it, and we happened to be doing it at about the same time that the reins were being loosened by Governor Deukmejian in terms of comprehensive health planning. So we got that hospital. That hospital has been it was a total community effort. We got volumes of letters from the community. We had all the elected officials behind us in both Fairfield and Vacaville. It was just one of those rare coming togethers, and it happened to be one of the very first things that we were able to do here at North Bay. So that's certainly an important thing in my mind personally. The other thing, which was again early on, because it showed what we could do if we wanted to do it here, because we had been just a primary care organization, little in the way of specialty services, but we had a very active OB unit. I mean, really busy. But we were shipping almost half of our babies to Mount Zion Hospital in San Francisco for neonatal intensive care. And those that weren't going to Mount Zion for that kind of care were going over to a hospital in Napa. And we started to ask ourselves, why are we shipping all these babies? We're parting a mom and her critically ill infant at a most crucial time. And we have enough volume to make it happen. Well, again, we were told by Mount Zion, no, you have no business. You're too small, you're too insignificant to do this. And the hospital in Napa said, well, no, you're going to hurt our program. So, you know, we had an uphill fight to get that done, but we did it. We have a top-ranked level 2 neonatal intensive care unit now. And the irony of all, of course, is Mount Zion Hospital is no longer in existence.
Right. I was going to say, many in the audience will scratch their head a little bit and go, I think that's, I see a campus sign at UCSF.
Right.
For that, right?
You know, but what that did, it showed that we could bring appropriately secondary services to this marketplace, and no one else in Solano County then or now does that, because we're the only locally based independent healthcare system in Solano County. So this is our world, okay? We're not looking to transfer patients to larger hospitals in our system elsewhere in the Bay Area or Sacramento. So that told us we could do it, and from there we got into trauma, and we do cardiac surgery, we do neurosurgery, we do a lot of things that we never thought we could do. So that neonatal intensive care unit showed what we could do. And then the third thing, very recent, last year, since you only gave me 3, is we became part of the Mayo Clinic Care Network, one of only 50 organizations in the world who are part of the Mayo Clinic Care Network. That is not an easy achievement. Less than 10% of the people who are considered are accepted by the Mayo Clinic for that designation. And it changed completely people's perception of NorthBay Healthcare in this area. People starting to say, whoa, I'd like to join your physician group and have my care taken care of by your physicians, because your physicians have access to the expertise of the Mayo Clinic. And so we're very proud of that, because it took us 2 years of work with the Mayo Clinic, and you know, they're very concerned that your culture and their culture are similar. And when I went back to Rochester, Minnesota, as part of this process, everywhere I looked, where there was a Mayo Clinic building, the first thing you see is the patient comes first. And that is part of our philosophy at NorthBay. We're patient-focused, and the Mayo Clinic is patient-focused. So, you know,
and you're walking that talk. It's
right.
not just talk,
right.
you're walking it.
Yeah.
So if I go back to the first two examples about building the Vacaville facility and the NICU, both of those, as I understand it, had a kernel in how do we serve a patient, the mom who was separated
right.
at a time when they shouldn't, and in a critical community of need, because really from here to Sacramento there was nothing.
Yeah.
Right.
And the thing that really drove it in Vacaville was the fact that we started to look at, Vacaville has a very robust paramedic program, but people weren't surviving as they should have the trip from Vacaville to Fairfield because of the distance. Okay, and so we were able to tie that robust paramedic program the city had to an emergency service in the city. Changed everything.
Right. Get them stable.
Right. Then you can
and
transfer
then
them to
you can
someplace you have
transfer
to.
them. Right. And now that's culminated 3-4 decades later in the Mayo, sort of the pinnacle.
Right. And you know, we're a STEMI receiving center, we're a chest pain center, we're a level 2 trauma center, we're all that stuff now. None of that was true then.
So one last question sort of in this area. So this is your fiercely independent health system
Mm-hmm.
in a region that has gone exactly the opposite. It's gone towards consolidation, scale, having to have health plans of scale. So the Kaiser, you drive up 80, you've got Kaiser on all three sides of you,
Mm-hmm.
as I can tell. What's behind the community the philosophy behind that, and how difficult has that been to stay independent?
Well, staying independent is one of the 3 tenets of our current strategic plan. So, you know, we keep it forefront in terms of our mind. You know, our market share hasn't changed in the 35 years I've been here. We've maintained 35 to 40% of the market.
Interesting. Despite payer mix changes
Yep.
and
Yep.
what's happened in
We've had,
Medi-Cal.
and you know, we've tried to stay ahead. We were one of the founders of Western Health Advantage, which is our integrated health plan. It's now almost 25 years old. I've been on the board since the beginning of that organization. And so that helped us, okay? So during the times when some of the other plans were giving us some problems, you know, we could always say, you know, we have Western Health Advantage lawyers. Okay, you can maintain your relationship with NorthBay. In fact, Western Health Advantage is almost always the more inexpensive plan, and almost always more inexpensive than Kaiser. So that has helped us. The fact that we have brought services that prior to NorthBay bringing them required you to go outside the county means that we serve Kaiser patients and other people on an emergency situation because we have the services here. That has helped us. I've looked at, you know, critically at what's happened at other organizations as they've decided to be part of a larger organization, and I write about this in my blog sometimes. And I don't know that people took the time to really consider the long-term consequences of what they were doing, and I firmly believe that there is a role still for a locally based independent healthcare system. And we showed here in Solano County, we are the leading system. We are the ones who have all the services. And if you look elsewhere in California, we founded another organization called California Healthcare Insurance, which is a risk retention group. And it's composed of independent systems and hospitals like North Bay throughout the state. There are other folks like us in the state. We just don't get the headlines, you know.
Like Barton.
Yeah, Barton, they're part of CHI, Chico, Enloe up there, Oroville, when the dam isn't breaking, they're part of it. San Antonio down in Southern California, Pomona Valley in Southern California. We're there, we're here. We just don't get the attention that the other folks get. But you look around right now, I'm seeing a lot of these bigger systems are having financial problems.
Absolutely.
And I think they've overreached, and I don't think they pay close enough attention to what's going on locally.
So in the last few minutes, that was a great segue into one of the career development issues that our membership faces, and again, the primary audience for this will be mid-careers who are facing shrinking management teams, especially at the larger facilities, fewer points of entry into the system. Very talented individuals and very passionate about what they do. What advice do you have for them? What pearls of wisdom and encouragement can you give them?
Well, first of all, look at people like us when there's an opening. One of the most disheartening things I've found when I've recruited senior managers, and it doesn't matter what position, it could be a CFO, it could be an operational person, it could be a human resources person. When I get them in here to talk to them, they can't conceive of what it would be like to work in an independent organization where they don't have what they consider to be all the resources of a headquarter. And you know, when I hear that, I say to myself, you know, I don't think you're going to progress in your own organization if you can't be independent and have confidence in your abilities. And so, you know, we end up seldom recruiting people from those larger organizations because they either don't have the breadth of experience that's needed because they've been pigeonholed, or even worse, I think they don't have the confidence in their own abilities because they don't. And that's a career limiting factor. Don't feel like you have to have all the security of a big organization around you. The smaller organizations like NorthBay really are in a better position to nurture your career than the larger organizations.
Build that skill set that'll give you the foundation of confidence.
Right, because you'll have more opportunity in an organization like us to do more things. Okay, and at least in NorthBay, the culture has always been from the board level down, you can fail. Okay? It's okay to fail as long as you learn something from that failure. And certainly, I've had some failures here in my career.
I wasn't going to ask you about the 3 regrets or failures. So.
but there've been things that thinking back, I said, darn it, I could have avoided this if I'd not done this. But I've learned from it. Okay, and I've had all of us senior managers who've had that kind of that experience here at NorthBay. You know, we probably should have done something different, but we don't live in fear of our heads being cut off by the board.
Thank you very much for your time today. And anything else you'd like to say to the audience?
You know, the blog that I'm writing that's going to be on Tuesday, I posed the question at the beginning, you know, did I make a right decision when I chose not to go to medical school and went into what was called hospital administration at the time? And I spent a few paragraphs ruminating over it, but at the end I say I made the right decision. And I think the ability to see the big picture and support the efforts of all the professionals in healthcare who deliver the care, you know, that's something special, and I don't regret a minute having gone in that direction.
And certainly from the position of what you've done, you've influenced large populations as well as now generations of leadership, while the one-on-one relationship that a physician has obviously very meaningful, but you've had the scale.
Yeah, and you know, one of my proudest things, he'll have this, but I had an administrative resident here 25 years ago, green as could be. Okay, well, he's now a nationally known healthcare expert. Brulin Stacy.
Sure.
Brulin got his start here, and now Brulin is chairman of the Malcolm Baldridge Award. He's a consultant. He's got a.
He's going to be at Congress this week.
Yeah. And Brulin got his start here at Linear Community Hospital as administrative resident for a year.
Thank you.
Yeah, thank you, Jeff.